Hello everyone, this is the topic have been chosen, the health system. Obesity. Obesity is a medical condition in which excess body fat has accumulated to the extent that it may have an adverse effect on health, leading to reduced life expectancy or increased health problems. Obesity increases the likelihood of various diseases, particularly heart disease, type 2 diabetes, obstructive sleep apnea, certain types of cancer, and osteoarthritis. Obesity is the most commonly caused by a combination of excessive food energy intake, lack of physical activity, and genetic susceptibility, although a few cases are caused primarily by genes, endocrine disorders, medication, or psychiatric illness. Obesity is a leading preventable cause of death worldwide, with increasing prevalence in adults and children, and authorities view it as one of the most serious public health problems of the 21st century. Obesity is stigmatized in much of the modern world, though it was widely perceived as a symbol of wealth and fertility at other times in history and still is in some part of the world. The BMI classification, or body mass index: 18.5 underweight, 18 to 24 normal weight, 25 to 29 is overweight, 30 to 34 class 1 obesity, 35 to 39 class 2 obesity, 40 is class 3 obesity. Mortality. Obesity is one of the leading preventable causes of death worldwide. Morbidity. Obesity increases the risk of many physical and mental conditions. Effects on health. Excessive body weight is associated with various diseases, particularly cardiovascular diseases, diabetes mellitus type 2, obstructive sleep apnea, certain types of cancer, and osteoarthritis and asthma. Survival paradox. Although the native health consequences of obesity in the general population are well supported by the available evidence, health outcomes in certain subgroups seems to be improved at an increased BMI, as phenomenon known as the obesity. The causes. At an individual level, a combination of excessive food energy intake and a lack of physical activity is thought to explain most cases of obesity. Sedentary lifestyle. A sedentary lifestyle plays a significant role in obesity worldwide. There has been a large shift towards less physically demanding work, and currently at least 30% of the world population gets insufficient exercise. Diet. The per capita dietary energy supply varies markedly between different regions and countries. Genetics. Polymorphism in various genes controlling appetite and metabolism predispose to obesity when sufficient food, energy, insufficient exercise. Other illness. Certain physical and mental illnesses and the pharmaceutical substances used to treat them can increase risk of obesity. Infectious agent. There is an indication that gut flora in obese and lean individuals can affect the metabolic potential. This apparent alteration of the metabolic potential is believed to confer a greater capacity to harvest energy, contributing to obesity. Pathophysiology. Hormonal mechanisms have been elucidated that participate in the regulation of appetite and food intake, storage patterns of adipose tissue. and development of insulin resistance. Leptin and ghrelin are considered to be complementary in their influence on appetite, with ghrelin produced by the stomach modulating short-term appetitive control. Social determinants. While genetic influences are important to understanding obesity, they cannot explain the current dramatic increase seen within specific countries to globally. The cause of the shift in these two factors on the social scale is much debated. There are a number of theories as to the cause, but the most believed is a combination of various factors. The public health. The World Health Organization predicts that overweight and obesity may soon replace more traditional public health concerns such as undernutrition and infectious diseases as the most significant cause of poor health. Obesity is a public health and policy problem because of its prevalence, cause, and health effects. Management. The most commonly used medication to treat obesity is sibutramine or Meridia, a recently withdrawn medication due to vascular side effects. The main treatment for obesity consists of dieting, and physical exercise. To understand more and to clarify obesity, we have two reinforcing and two balancing loops. So here the additional information. Obesity is a complex disease involving an excessive amount of the body fat. Obesity isn't just a cosmetic concern. It is a medical problem that increases the risk of other diseases and health problems, such as heart disease, diabetes, high blood pressure, and certain cancers. Obesity means having too much body fat. It is different from being overweight, which means weight too much. The weight we come from muscle, bone, fat, or body water. Both terms mean that a person's weight is greater than what's considered healthy for his height. Obesity was traditionally defined as an increase in body weight that was greater than 20% of an individual's ideal body weight, the weight associated with the lowest risk of death as determined by certain factors such as age, height, and gender. To have more information about obesity, here's the link. Thank you.